Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, internal medicine physician, psychiatrist. Today's Kevin MD article is The Future of Psychiatry, How AI and Genetics Are Reshaping Mental Health Care. Muhammad, welcome back to the show.
Thank you very much for having me to talk to your audience about the future of psychiatry and how new modalities are going to be helpful for our patients.
All right, tell us what this article is about for those who didn't get a chance to read it.
So, in the article, I introduced the audience to the field of psychiatry. And not a lot of people know, but actually, in the field of psychiatry and medicine, that actually four of the signatories on the Declaration of Independence are physicians.
Hmm.
Out of 39, four of them are physicians. So the art of medicine, the art of psychiatry has been in the core of this nation. Dr. Benjamin Rush, who's the father of American psychiatry, his face is on the emblem of the American Psychiatric Association, his silhouette. He was one of the signatories of the Declaration of Independence, and he actually led the Pennsylvania delegation that ratified the Constitution. So psychiatry, medicine has been at the core of this country for a long time. But we are seeing a significant seismic shift in the field of psychiatry because we are utilizing now new tools that are going to help us both with assessment and diagnosis of individuals who have psychiatric illness on all levels. And we're going to be able to move away from this subjective approach where we ask patients how they feel
Mm-hmm.
and we base our treatments on that, as well as on the clinical opinion of the treating psychiatrist, which ends up with a lot of inter-rater reliability issues where if you have a psychiatric diagnosis, 50% of psychiatrists will agree with that, and the other 50% won't agree with that and will have a different diagnosis. So I think we're moving in the right way of being able to offer our patients accurate diagnosis and offer them some accurate treatment modalities.
Now, why has psychiatry historically lagged behind other medical fields when it comes to adopting objective diagnostic measures?
The field of psychiatry is has been very difficult to crack. You know, in cardiology, you have the ability to do an EKG. You have the ability to do imaging, echocardiograms, cardiac CTs, cardiac catheterization. So you have the ability to visualize what's going on. And the heart technically is a very simpler organ than the brain.
Hmm.
We've not been able to do that for psychiatry. I mean, we have neuroimaging, we have functional MRIs. We've been able to slightly now, with new modalities, be able to look at the actual activity of the brain in real time. We have EEGs, we have functional EEGs, but we think that there are some improvements because, for example, Neuralink, which is a device that links with the brain and is able to translate some of the brain signals into instructions of individuals, for example, with different paralysis, they're able to utilize that device to gain some movement. But we've also been able to utilize some EEG modalities, specifically both for diagnosis as well as for treatment. There is now a new device that's being approved for both the treatment of PTSD and anxiety that utilizes an AI model where an EEG is hooked to the brain and it involves a biofeedback loop where a person is supposed to calm down, be able to settle down by integrating into an AI environment and be able to de-escalate their anxiety and depression. And that's actually being FDA approved for both depression and anxiety. So we are seeing some improvement, but we're really far away from that just because of the complexity of the brain.
Now, you talk about several options. You mentioned a few just now, and we have things like pharmacogenetics, we have biomarkers. So tell us some of the more promising approaches that we have to look forward to going forward when it comes to objective psychiatric measures.
One of the most promising one is actually genetics and genomics.
Hmm.
The Human Genome Project cracked our human genome at the beginning of the 2000s. We used to think that our body had maybe millions of genes, but we were surprised to find out that we only have about 100,000 genes. But there's a lot of areas in the genome that are silent areas, but actually do affect the translation of our different genes and do affect function. We have not been able to really crack the code literally of being able to say, if you have this gene, you are more susceptible to this psychiatric diagnosis. We're still not there yet. We have some polymorphisms that we think are promising. We have some polymorphisms that we use and that are FDA approved for our response to psychotropic medications and whether we're going to be able to metabolize them. But we are far away, but we think AI may be able to help us in terms of being able to do a genome analysis and tell a person who is 15 or 16, well, you're going to be developing depression, anxiety, schizophrenia. We're not there yet, but we are hoping that we're going to be there one day and that hopefully we're going to have more of a preventative approach rather than a therapeutic approach. Somebody develops schizophrenia and then you treat them. Maybe if you're able to find out that they're going to be at risk for developing schizophrenia, you maybe treat them prophylactically. Maybe they will not smoke marijuana and be at a higher risk. Maybe they won't use drugs. Maybe they won't be in a stressful scenario that would ignite that schizophrenia. So we're hoping that we're going to be there soon. We also think that AI is going to be able to help us in terms of being able to have preliminary diagnoses on our patients. So there are AI models now that are looking at speech. So as I speak, AI is going to be able to do a comparison between somebody who has no psychiatric illness and another individual who has, for example, schizophrenia, depression, or anxiety. And we are very close to having some large databases where AI is going to be able, just from listening to somebody's speech for about 3 to 5 minutes, to be able to put a high likelihood of somebody having depression, anxiety, or maybe schizophrenia. Facial features with AI are also coming as something that's going to be available. We are actually now currently using AI for facial features for adverse effects with antipsychotic medications. So tardive dyskinesia, AI is able to assist the clinicians in terms of diagnosing tardive dyskinesia, which is a side effect for antipsychotic medication, just by looking at the pictures and looking at somebody's movement. Within a minute, AI is able to give you a significant probability whether somebody does or does not have tardive dyskinesia. So we're already there in some measures, but not where we want to be, where we're having these tools assist us in diagnosing psychiatric illness.
You also bring up the category of biomarkers. So what kind of biomarkers can we measure, say, through the blood that may point to potential psychiatric diagnoses?
So we're looking at different biomarkers, and you know the psychiatry was one of the oldest field of having some biomarkers. And you know, like for example, with diabetes, you have blood sugar, you have insulin levels. Early on, psychiatry developed looking at cortisol levels and cortisol suppression tests and association of that with depression and anxiety. There are multiple biomarkers that we're looking at in terms of blood analysis for depression and anxiety and PTSD, and specifically also for dementia as well as autism spectrum disorder. They're still being tested. I don't think that we're there yet of anything definitive, but there are several that are in phase 2 and phase 3 trials in terms of being diagnostic value for individuals with psychiatric illness. But we're not there yet. We still utilize just the regular markers that we've utilized 50, 60 years ago. But we're hoping that we're going to be there in the next few years. AI is going to help with that also.
So give us a scenario or story of one of these technologies and how that would change what you do in the office with a psychiatric patient. So tell us how would it change your therapeutic and diagnostic approach once we have some of these technologies in play.
Sure, absolutely. I'll give you a practical story, a real story that I encountered with one of my patients, and using a modality that we didn't talk about, wearables. Now they're very prominent. Everybody has a watch that's either an Apple Watch or some other modality. A patient was complaining that they were not sleeping well, and I encouraged them to use a wearable that they have so we can have a better understanding and analysis of their sleep pattern. Their impression was that they were not sleeping. Their impression was that they are not feeling rested in the morning. So we encouraged them to use a wearable, an iWatch, just to look at their sleep pattern and whether they were sleeping or not. And when they returned for their next appointment, because they were asking for a sleep aid to help them, that may not have been very therapeutic or helpful for them because of their condition. We found out looking at the wearable that they were actually getting about 6 or 7 hours of sleep, which is a reasonable amount of sleep, while their impression was that they're not sleeping at all or 1 or 2 hours at night. So this is a modality where actually if the physician is integrated into the wearables and can do home monitoring, additionally things like medication management, as well as systems to ensure
Hmm.
medication compliance, whether the patient took their medication or not. So we have the integration of technology into that therapeutic system. Also, for example, I had one of my patients who I was actually trying to lose weight after he gained significant amount of weight with his antipsychotic medication. And he actually went to an outside company that would do, for about $50, would do genomic analysis on multiple variables that where there are some literature about how a person should go about in terms of their diet. And he discovered that he was very sensitive to carbohydrate
Hmm.
and he to carbohydrates, and that those would actually initiate his insulin resistance pattern. So he actually cut carbohydrates completely or as much as possible from his diet. And he ended up losing 25 pounds. This is how much weight he had gained with the antipsychotic medication, also guided by genomic testing that wasn't even physician initiated. He got the tests on his own. There was a large clinical trial that looked at that polymorphism, and he found out that if he cut carbohydrates, he'll lose weight. So our patients, if we ally with them, can be really, really very helpful in terms of trying to assist us with wearables, with AI, and with available testing that is outside the medical field. So I think being able to utilize some of those modalities would be very helpful for our patients.
So, how far off are we in terms of implementing or seeing some of these technologies used in everyday psychiatric practice? Are we talking about way off in the future? Are we talking about in the coming months? So, what
I
kind
think
of vision do you
in the
have?
coming years, I mean, for some of them, we're already here. I mean,
Yeah.
with wearables, I think we're already here. I think any physician who's not utilizing the wearables with behavioral analysis and how the patient is doing at home is doing a disservice to their patient. They
Mm.
need to use that data from the wearables to assist their patients. I think AI is here. I'm actually involved in a pilot project where we actually take a 15 to 30-second video of our patient and look at movement disorders and tardive dyskinesia. Also, speech pattern is there. There is a company that is collecting a large database of speech pattern for patients and doing comparison to normal individuals to see if they can have a AI pattern for psychiatric illness for, or at least predictive of psychiatric illness, whether current or future psychiatric illness. So I think we're here, and in the next year or two, we're going to see a deluge of those modalities coming into the medical fields. And I think physicians really need to be up to date on that because our patients are going to be asking about it, and we
Hmm.
need to be ready for that.
What about psychiatrists themselves? Do you think they're ready for more objective measures? Do you see any resistance among the psychiatric profession to adopt some of these new technologies in a field that traditionally has been resistant to objective measures?
I think I see some of that from my colleagues, but I think we have to go with our patients. I mean, we can't have patients come to us and say, well,
Mm.
look, here's what my wearable says. I'm not sleeping. I need you to help me with this. Or you can ask your patient for data and then you can have a dialogue with them. Well, look, this says that you're sleeping well.
Hmm.
You don't need a sleep aid. Your sleep is sufficient. If you're not feeling well, then maybe we need to look at other things. And also just using that technology to help our patients and keeping us updated about how they're doing and doing surveys. I think that is there. But the some of the older generation psychiatrists are resistant to that change, but I think it's here and we have to adopt it. Otherwise, we're going to be left behind by our patients who are demanding it.
We're talking to Muhamad Aly Rifai. He's a psychiatrist and internal medicine physician. Today's Kevin MD article is The Future of Psychiatry, How AI and Genetics Are Reshaping Mental Health Care. Muhammad, as always, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I think AI and genetics as well as biomarkers are here to stay. They're the future of psychiatry. There's some apprehension from the older generation psychiatrists about this change that's going to be happening, but we have to embrace it. In my case, I was a thought leader in the field of telehealth, and we're seeing all of these modalities coming. And I think we need to adopt them because for the benefit of our patients and to move the field of psychiatry forward with treatment as well as therapeutic values.
Muhammad, as always, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
My pleasure. Thank you.